Hi, everybody. Welcome in. We've got a good group joining today for our webinar. I'm going to get started just right now. We've got Jennifer here today on chat support. There's a lot of you guys in here, so go ahead and feel free to drop your questions about this webinar in the chat section. She is happy to answer them, but do bear with her because she's not a robot. She's a real person, so it will take her just a little bit of time to get back to you guys. I hope everyone can see my screen here and hear me okay. If everyone can't, let me know in the chat. But if just one or two people, I always recommend that if you're having issues with a webinar, literally the best thing you can do is exit the webinar and then join again. A lot of times that fixes the tech issues. I am not super tech savvy, and so I have had to many times leave a webinar and rejoin later, and that tends to fix most things. I'm joining today with you guys from Utah. Drop in the chat where you guys are joining from. I'll be excited to hear. There's so many beautiful places all across the world, and we really do have a really good global amount of participants. So it's fun to see where everyone's coming from. I already see Miami, Canada, California. We've got a wide Jamaica. See, I wish I was in Jamaica right now. Maybe the next webinar I do, I'll be joining from Jamaica. The hope here today, guys, is that you really are able to master the 12 cranial nerves. It's very testable on nursing school. It's testable on the NCLEX, and then it's also just super pertinent to neuro assessments that we do on every single client that we have in the ICU, in the emergency department, really wherever you're going to end up. So it's important that we understand the 12 cranial nerves and how to assess them, what we would be thinking if there's something wrong. So I'm going to walk you through the 12 cranial nerves today. We'll do a lesson on that, and then we'll go ahead and end with a couple of practice questions that I think is really going to drive home this information for you guys. This my webinar today on the 12 cranial nerves is actually pulled from Archer's new nursing school product. We put it out just a couple months ago, just September, so it hasn't been around too long for you guys. And because of that, it is still offered for free. That was a really big thing. I helped lead up this project. We've been working on it for, about 2 years at this point, getting this up and going for you guys. And it was really important for us that it be offered free for a long time so that you guys can sign up and get access to it, because I lived off top ramen in nursing school. So I understand that finances can be challenging and we want it to be affordable and accessible for you guys. So with nursing school, there's 20 different courses. Right now, I'm going to be pulling from our health assessment course. It's one of the fundamental things you're going to learn in nursing school. I have 14 modules in that course, tons of little mini lectures of different little clips of things to do. Like there's over 1,000 on-demand lectures for everyone, which is just really awesome. Just breaks down everything super simply for you guys so that you can easily access things. You don't have to worry too much. And then with that, we've got over 5,000 practice questions for you guys to do, and then over 200 cheat sheets. And cheat sheets are something that I really wanted to design. They're designed by our medical illustrators and our design team. They're one-page summaries of the most important information. So there's an entire cheat sheet for you guys that you can go download and keep on your iPad or your laptop, or you can even print and laminate. I was always really old school that way. And they're great little study tips. So it includes mnemonics for you, images, the most important things you need to know for a test. I think that they're really useful for guiding your exam preparation. So understanding that, you can't memorize everything as a nurse, but there are some things that you actually do need to memorize. And so with that, you want to make sure that this is the information that you start with and that you make sure you know. So right now, as I said, everything's free. You can scan this QR code with your phone, or there's the link right here to the website. If you just go to archerreview.com and you click on nursing school there, you can sign up. Once again, every one of the courses is totally free right now through the end of the year. So sign up, whether you're done with nursing school and just prepping for the NCLEX. I think that there's a lot of information in here and a lot of products like the cheat sheets that really can help your exam prep in school or for the NCLEX. Okay, now that we've talked a little bit about nursing school, we can move on to actually looking at the cranial nerves. And so with that, the very first thing we want to do when looking at the cranial nerves is know the order of the cranial nerves. And here they are listed 1 through 12. This is the Roman numerals. I am embarrassed to admit, and I will admit it on camera in this webinar with hundreds of you guys in here, just so that you maybe feel a little bit like you're not the only one. I think college was the first time I actually learned how to count Roman numerals. I was not taught this when I was young. And so this actually was one of the hardest parts of me for knowing the cranial nerves because they're usually put in their Roman numeral format. So it's not just going to be listed like cranial nerve 12 with the number 12. It may be that XII, which is the Roman numeral for 12. So make sure that you understand Roman numerals first off so that you don't get confused. Then you want to know the name that is associated with that number. When I say learning the order of cranial nerves, the most important thing is not actually knowing it's not a specific like chronological order where it's important to know that 12 comes after 10. When I talk about knowing the order of cranial nerves, what's important is knowing that 10 is the vagus nerve and that 1 is the olfactory nerve. That's because we're often going to switch back and forth between the cranial nerve number and the cranial nerve name, and they have very specific functions. We know that the cranial nerve 1 olfactory innervates the nose. And so it's important that you understand if someone's talking about cranial nerve 1 or they're talking about the olfactory nerve, that that's associated with the nose and that those are the same thing. So that's why you want to know the name and the nerve number. There's a mnemonic put over here. I think it's very pertinent right now because we're in the fall and there's nothing better than Harry Potter in the fall time. Mnemonics are really helpful for me. I know that everyone's brain functions a little differently. So if mnemonics are not helpful for you, don't worry about memorizing this. This is not necessary to know this mnemonic. I find that it's just helpful sometimes if you're like, oh man, that F1, the facial nerve, what number is that? And you just say, oh, they traveled and found. Then you're like, okay, that's cranial nerve 7 is facial. So that's where I find mnemonics to be helpful. Some people also find it helpful to remember the name rather than a mnemonic, understanding what it is. So glossopharyngeal, it's the pharynx, it has the word pharynx in it. That's going to give you a little bit of an indicator about what that cranial nerve does. So sometimes the names can be super helpful. You also want to know the function of the cranial nerves. That's going to be super important as well, understanding not only just the name and the order, but what they do. That's probably one of the most important things. We break cranial nerve function down a couple different ways. We classify them with sensory, with motor, and then some cranial nerves, just a few of them are both sensory and motor. Of the 12 cranial nerves that we have, only 4 of them are considered both to be sensory and motor nerves. So you want to make sure that you know those. As kind of the name implies, it's not super hard to understand there. Sensory cranial nerves have sensory function. So that would be something like our 5 senses, like smelling, touching, seeing, hearing, tasting. Those are going to be the sensory nerves. Motor cranial nerves are kind of funny because I think we think cranial nerves, they all have to be in the head, but a motor cranial nerve has the sole function of movement. So it can be moving your face, your jaw. Some of them even are moving your shoulders or neck. It goes down up to your shoulders. So that's all going to be super important there. This mnemonic is one of the mnemonics that I found to be the most effective that I learned in nursing school. I still use this all the time because this one, it was easier for me just to memorize the cranial nerve name and the number it went with. But function feels a little weird if you can't remember what it does. And if you know function, if it's sensory, motor, or both, it's going to help when you're actually assessing the cranial nerves or you're answering a question on the cranial nerves. So you want to be able to recognize, okay, cranial nerve 7, facial, is that sensory, motor, or both? And the mnemonic helped me run through that. So some say marry money, but my brother says big brains matter most. I've also heard matter more. So either one of those, I think this is a really good way to help memorize the function of the cranial nerves. So that's one I might put in your back pocket. Take a picture of this one and memorize that if you think it's going to help you remember the function of the cranial nerves. And we'll talk more about function as we go throughout each of the 12 cranial nerves. So now you understand the name and the order of the cranial nerves, and you understand the function, whether they're sensory, motor, or both. So now we're going to get into specifically looking at how we assess those cranial nerves. And before you ever do a cranial nerve assessment, you want to make sure that you have your materials. And I always put this here because I think sometimes it's easy to forget some of these materials because they're a little weird. salt or a sugar packet, that is not something you're going to use very frequently. Honestly, it's not going to be something you use very frequently, even when you're assessing cranial nerves, but you still want to make sure that if you have a worry about a cranial nerve, that you have brought all this material in. Pen lights are going to be one of the most important things, along with a tongue blade and a Snellen chart. Various aromas. That one is going to be kind of facility dependent about what they provide for you when doing a neural assessment. A lot of my facilities that I've worked in didn't have anything. In nursing school, usually they'll have like a little container of coffee beans for them to sniff or vanilla. As a little last minute thing, if you don't have anything and you want to test scent, you're worried about their, olfactory nerve, an alcohol swab is a really quick option. I almost always have alcohol swabs in my scrub pockets. And so those are really easy to just use if you have nothing else on hand. So once you've got all your materials and you go into the room, we look at how we assess cranial nerves. So what order do we do them in? Do we do all of them? Do we just do some of them? And that's really going to be up to you as the nurse using your nursing clinical judgment. The first thing I would say is that we always assess any cranial nerve that we're worried is not functioning. So that could be, someone comes in with COVID, they say they can't smell or taste anything. We'd want to make sure that we assess those cranial nerves associated with that. Someone had a stroke and they're having difficulty swallowing or they're having facial drooping. We want to assess those cranial nerves. So a lot of times a cranial nerve assessment will be very specific and very guided. It's just going to be point of care, this one cranial nerve or these two cranial nerves that we're worried about. But you'll most often see cranial nerve assessments done during a head to toe. And I don't know where you guys are at in your nursing program. You can tell me below in the chat where you're at, what course you're struggling the most in. But head to toes, normally you learn that in health assessment, one of the first courses you take in nursing school. And with a head to toe, you're of course functioning and working in that head to toe aspect. So I don't know if you guys had to do a pass off. I did in my nursing program. I even had to do a head to toe pass off in my grad school program, where you literally work all the way from the head down to the toes. And that's a really easy way to assess all 12 of the cranial nerves at the same time. But even when you're doing a head to toe, you can do it in two different ways. You can do, head to toe where you literally move from head to toe. So you do it directionally. And so as you go, down to the shoulders, that's when you're assessing that one. That's a really good way to do it because, it is in a good flow. So it makes sense in that head to toe flow, but you are sometimes likely to then miss a cranial nerve if you miss a step in your head to toe. Some people prefer to do just the entire head to toe assessment that they're doing, and then they'll just come back and just do the 12 cranial nerves and they go in order. So, I'm doing cranial nerve 1, I'm doing cranial nerve 2, I'm doing cranial nerve 3. So just find the flow that works for you. There is not a right answer and there's not a wrong answer. It's just going to be entirely dependent on what your preference is as a nurse. And I would just recommend, this is from me with years of experience now at this point, find your flow and stick to that flow. I think that's going to be the easiest thing to do is just once you get it down, if you decide you're always going to just do cranial nerves at the end of your head to toe, all 12 of them, do that and stick to that. Or if you decide you're going to do them in order from head to toe, start that and stick to it. People mess up the most when they bounce back and forth between the way they do things. They don't always do their head to toe in the same order. That's going to put you at the highest risk for missing part of your head to toe. So that would not be my recommendation. Just go in the order that works best for you and do that same way every time. Remember, repeating something is the key to success, I think. It's same with memorization. The more you do things, the more you hear something, the more you practice it, the better you're going to get at doing it. Now we're really on to assessing cranial nerves. We're on cranial nerve 1, which is olfactory, or if you guys go by that mnemonic, it's the first O. And olfactory, if you think about that word, if you guys know the roots of that word, of course, you're going to know then that the function is our sense of smell. So cranial nerve 1, I think of, we just have our one big nose right there. That's 1. So cranial nerve 1, once again, olfactory, that is your sense of smell. And the way that we assess that is this is when we bring in that thing that we brought in for clients to sniff. So whether that's a vanilla bottle or coffee beans or alcohol swabs, if you're going to test the different nares or nostrils separately, which would be my recommendation, you kind of need 2 scents. Because what you're going to do is you're going to have the client close their eyes, plug one nose, So now I've got one nostril closed, and then take a big inhale of the scent that you brought. So if it's vanilla first, you're going to have them take a big scent of that, and then they're going to tell you what they thought they smelt. And then you're going to have them close the other nostril, take a big whiff, and let them know what you smelt. Reasons that we can have issues with the olfactory cranial nerve, there's a few of them. Of course, you have to think of obstruction first off, because it's the most frequent. More than just nerve damage, if the nose is totally blocked, so, they're super stuffy, they have allergies, they have a cold, their sense of smell is going to be decreased. And that would be a normal assessment finding for that client. So if you already know that they're in the midst of a really brutal cold during cold season and they can't breathe through their nose, don't expect them to be able to smell through their nose. They can't even really get air in there. If they have good, or what we call patent nair, so they can breathe through their nose and they can't smell, that's when you would start to be concerned about a issue with cranial nerve 1. The specific term we use in the medical world for issues with cranial nerve 1 is anosmia. Okay, so that just means an inability to smell. So if you ever see that term on a test or on the NCLEX, just put it together. Know that you should be thinking issues with cranial nerve 1. Does that make sense for everyone? So that is our olfactory nerve. Now we can move on to cranial nerve 2, which is our optic nerve. As far as the eyeballs go, you have to think about how complex our eyes are. They do a lot of different things. If you think about it, they move a lot of different directions. So there's going to be motor functions there. They are in charge of our vision. So there's going to be sensory functions there. So we already know that we've got a lot of different functions going in our eyes. They serve sensory functions, they serve motor functions. They are our ability to see color, our ability to see objects, our ability to see peripheral vision, our ability to dilate our pupils or constrict our pupils based on how much light there is in a room. So our eyeballs are very important, and that's why 4 of our cranial nerves of the 12. So that's actually 1/3 of the cranial nerves is responsible for parts of our eyeballs. So I like to remember cranial nerves 2, 3, 4, and 6 are all in charge of eyeball stuff. So if you can remember that, 2, 3, 4, and 6, all in charge of the eyes. If you go through our mnemonic that we looked at first, some say, so cranial nerve 2, while it is in charge of the eyeballs, is only sensory functions. So this is specifically our visual acuity. And I remember that one because we have 2 eyeballs. So that's our optic nerve. You have your 1 nose for olfactory, 2 eyeballs for optic. The way we assess cranial nerve 2 is with a Snellen chart. That's going to be the easiest way to do it. There's a couple different versions of a Snellen chart. I think it's called a Rosenbaum chart. That's going to be specifically if your client doesn't speak the same language as you, or maybe they can't read, they have dyslexia, letters are hard for them. There's some that have images on them. So they'll go down the lines and they'll say, oh, that's a house, that's a tree, that's a boat, that's a baseball. There are some that have signs on them. There are some that have numbers, if numbers are easier than letters for your client. So assess your client, know their cultural background, know their education level, and that's going to decide what chart you use. So you should be set there. You want to make sure, though, the big important thing with Snellen charts is that they are wearing glasses if they have glasses, or wearing contacts if they have contacts. This is something that I see nursing students get tripped up with every once in a while, is, they wonder, okay, do I wear this with, should the client have glasses on, or should they not have glasses on? Do they wear their contacts? Do they not wear their contacts? I like to think of it this way. When we're using a Snellen chart, we want to see how good their best vision is. So when we've totally made their vision as good as it can be, how good has it been? And so with that, you want to make sure that they are in fact wearing their contacts. They are in fact wearing their glasses if they normally wear those. So if they have glasses on a day-to-day basis, you're going to make sure you put their glasses on for this test. Does that make sense? A Snellen chart is going to have specific instructions that you go, and that's going to be based off the size you use. I, as a nurse, almost always carry around in my scrub pockets a little mini Snellen chart. You can get them on Amazon, you can get them at Walmart. They're really cheap. I like them just because they're easy to test a client. Then I don't have to get my client up, walk them all the way over to where the Snellen chart is in the hospital. I just have this tiny little chart that fits in my pocket that I can use whenever I want. With a small Snellen chart, though, of course, the client is going to stand closer to it than they would with a big Snellen chart. It's like 36 centimeters, I think, for the small one in my pocket. And so just know that you're looking at the instructions on the chart you're using to decide how far away your client's going to be. We then have them close one eye at a time, like we have this client using here. So normally they just cover one up with their hand, and you test one eye at a time, the other eye, and then you test both eyes. This is going to give you a really good overarching idea of their vision. And so you're going to read down the line, have them repeat the letters, and then you count the line that was the very last line that they could accurately read the letters or the numbers or the pictures on. I go into a little bit more depth about how to use a Snellen chart and how to interpret it. You know, what does 20/40 mean? What does 10/200 mean in my health assessment and my fundamentals course? So if that's something you struggle with, go ahead, go to that QR code or that link, archerreview.com, and sign up for those courses for free. And I have cheat sheets on them for you. And I go in depth because that was something I really struggled with in nursing school, was the what number goes on top and what number goes on bottom. So I give you guys a couple tips and tricks for that. We don't have time to really dive into depth in that today, but like I said, that course is free right now. You don't even have to put in payment information. So go ahead, sign up for it, and you can, listen to me talk more about Snellen charts. Cranial nerve 3, once again, remember we said 2, 3, 4, and 6 are all eyeballs. So with cranial nerve 3, oculomotor. This really helps me because oculo, eyeballs, ocular means eye, and then motor, so eye movement. So that is one of the ways that I remember that cranial nerve 3 helps move the eyes. It's called oculomotor, I think. This is, Annie's opinion. I should preface that. I remember that it's oculomotor when 4 and 6 also move the eyes, because this is the one that does the most eye movements. There's a couple different eye muscles in the eye. We have, the medial, we have lateral, we have superior oblique, we have inferior oblique. We have all sorts of different muscles in the eye. And so with that, the way that these cranial nerves innervate, they innervate different muscles. Cranial nerve 3 does almost all of the eye movements except for 2. So cranial nerve 4 is in charge of one eye movement, and cranial nerve 6 is in charge of one eye movement. And that means cranial nerve 3, oculomotor, is in charge of all the rest of the ways that we move our eyeball. So that includes any eye movements up. So if you move your eyes up to the sides, if you move your eye down and out, so away from your nose, that's cranial nerve 3. And then also if you look towards your nose. So I don't know if I looked cross-eyed there, but when you look towards your nose, that is also cranial nerve 3. Once again, oculomotor. But I want you guys to not forget these last things, because this is what I tripped up on in nursing school a lot, is I would forget that because it says oculomotor and I know it's eye function and eye movements, I'd be like, okay, that's the role of cranial nerve 3. But if you think about our mnemonic again, some say marry, money. So they actually have a couple different purposes, because it does those eye movements, but it also is going to control the muscle that opens the eye. So just being able to blink and open our eyes, that's cranial nerve 3 again. And then also that muscle that constricts or dilates our pupil. So when we check PERLA, pupils equal, round, reactive to light, and accommodation. So that's what PERLA stands for. That's also going to be cranial nerve 3. So this one is really hefty. There's a couple different ways we test it. Of course, like we said, if your client is blinking and opening up their eyes, cranial nerve 3, that is going to be intact in that regard. Next, we're going to assess PERLA, and that is going to check for light reflex and accommodation. You use that with a pen light. So what you're going to do is have your client face you. So they're going to be head on. So looking at you, you're looking at them. You're going to grab your pen light. And what you're going to do is I go one eyeball at a time, because you want to make sure that they both go. Turn your pen light on, and you're going to shine the light in the client's eyes. What you're expecting is that when you shine the light in the client's eyes, that pupil, so that dark circle in the center of the eye, is going to constrict or get smaller. Then you're going to do the same thing on the other eye. And you also want it in the same size to constrict again. And then when that light is taken away, that pupil is going to dilate or get bigger. Then I shine the light right in between their two eyes. So then after I've checked both eyes, I shine the light right in the middle of those two eyes, and I just check that the eyes look even. One of the big signs of a neurological issue, or for example, brain trauma that would be concerning, is what we call a blown pupil. So that is going to be when one pupil is way bigger than the other. That would be concerning and something you want to report to a provider. This is also a great time where you can see, is their red reflex in kids intact? Well, that can be a sign of cancer in kids. So you want to look for that. Is the pupil a normal size? So not only are they just equal in both eyes, but do they look round? Some pupils will have, little leakages on them, or it will look kind of like an ink splatter, like number 2 shows there. That would be something else you'd want to report to a provider. So make sure that you're paying attention to all of that. And that's really going to help as you are assessing cranial nerve 3. Then lastly, you're going to do the cardinal directions. Remember, we said the eyes move in 6 cardinal directions because they've got all those muscles. And so with that, I normally assess the cardinal directions all at one time. I don't find it effective to, just do the ones that, cranial nerve 3 is in charge of, and then do something different. And then later come back to cranial nerve 4 and do the one direction cranial nerve 4 is in charge of, and then do something different, and then come back to cranial nerve 6. I don't find that to be super effective. So I go and I just do all the cranial nerve movements for the eyeball at the same time. So with that, you're going to have them look at you with both eyes and tell them to follow your pen light or follow your finger. And then you just move that finger in the 6 cardinal directions. So I just say, keep your eyes on my finger and just watch it as it moves. So then you're just going to move them laterally. You're going to move them medially. You're going to move superior and superior again. Then you're going to go inferior. So just do all 6 of the movements. If the eyeballs are able to move in all directions, that's a really good indicator that cranial nerves 3, 4, and 6 are all intact. Cranial nerve 5 is a weird one, I think, because it's kind of just, we said 3, 4, and we're on cranial nerve 4. See, look at the Roman numerals are tripping me up again. Cranial nerve 4 is trochlear. And so once again, this is going to be eye movements, but it's your superior oblique muscle. And superior oblique is, I think, a misleading name because that's the name of the muscle, but it moves the eye inferiorly. So the way I remember this is if you remember that it's the superior oblique muscle, the oblique muscles of the eye always move the eye the opposite way of the name. So the superior oblique muscle's on the top of the eye, but it moves the eye downward. So remember, oblique, opposite. So if someone tells you, a client has issues with an oblique eye muscle, know that they're going to have issues with eye movement the opposite of the name of the muscle. So superior oblique eye muscle causes issues with inferior eye movement, specifically down and inward. So if you take your eyeball and you look down and towards your nose, that is going to be cranial nerve 4, which is your trochlear nerve. That's what that one's in charge of. Once again, you just assess that, having them look at your pen light or your finger and follow those movements. Trigeminal nerve, which is cranial nerve 5, I skipped ahead a little bit early, missed 4, is the one that I think is a little weird because we said 3, 4, and 6 are all eye movements. I mean, even 2 is. So 2, 3, 4, and 6 are all in charge of the eyes. And then there's like 5, just like randomly sprinkled in there. So just remember 5, trigeminal, or traveled for a mnemonic, does not deal with eyeballs. That's something that I see students mess up pretty commonly because they've got on such an eyeball run. We just did 2 eyeballs. We just did 3 eyeballs. We just did 4 eyeballs. 5, this has to do with function of the face. And now if you remember our other mnemonic, some say marry money, but. So this is our first cranial nerve of the 4 that is both a sensory and a motor function, okay? So we have sensory issues and we have motor issues. And so trigeminal means that we're going to need to test both the sensory function and the motor function because one may be intact while the other is not intact. So the sensory function of trigeminal nerve is it lets us feel things on our face. So if you take your fingers right now and you tap on your face, that is going to be your trigeminal nerve. When you feel things, you feel your little fingers moving, or if someone tickles your face, or have you ever felt when you have like a hair somewhere and you brush it off, that little light sensation? That is going to be trigeminal nerve. That's cranial nerve 5. But then you also have motor function. That is going to be specifically the motor function of the jaw. So that ability to like clench our jaw or open it, that also trigeminal nerve. So this is a really important cranial nerve, I think. If you could rank them in importance, which I don't really think you can, I would definitely put this one as one of the most important, I think, because I love to eat. So I need trigeminal nerve, cranial nerve 5 to be intact so that I can move my jaw and chew my food, okay? And I also love a good tickle, so that sensation, that's important. So with these, we test it in two different ways. The first thing you're gonna do is test sensation. This is where those cotton tipped applicators you brought in are really effective. What I like to do is I take the cotton tip and I pull the little cotton part on the tip to kind of make like a long little fluffy part. Because what you want to do is you want to test for that feeling of like when a hair tickles your face and it's super light. And you also want to test their deep sensation or sharp sensation. So what I do is I use just both ends of the cotton tip applicator. So normally a cotton tip applicator will have that little soft cotton part and then a long little wooden stick. So I'll have the client close their eyes and I'll say, let me know if you feel sharp touch or soft touch. So they've got their eyes closed and I'll just gently touch them and they'll say, oh, that was soft. And then I'll flip it to the other side of the cotton tipped applicator, that wooden part, touch them again and they'll say sharp. And then I just do that at a couple different spots around the face so that I can get a good idea that, they have full sensation in their face. So that takes care of the sensation aspect. Now we have motor. So with motor, what you're going to do is just put your hands right here on those masseter muscles on the jaw and just have the client clench their jaw. You're going to be able to palpate that muscle right there. Sometimes guys or even some women will have really strong jaw lines or really strong masseter muscles, and you can really palpate them. So just have them clench their jaw and you'll feel that muscle there. That lets you know that the motor aspect of cranial nerve 5 is also intact. As a little side note here on this little post-it note that I put here for you, dysfunction of trigeminal nerve should always make you worried about trigeminal neuralgia. So how that presents normally, which gets a little bit too in depth for you guys, but I think is important to know for practice, is if you have a client come in and their face is on fire, it hurts really bad. Normally, it's not like a decrease in sensation. Normally, you won't see issues with trigeminal nerve where it's, they just can't feel anything. It's normally that they are in a lot of pain. It feels like their face is on fire. Trigeminal neuralgia is like this inflammation of cranial nerve 5, and so it's going to be very painful. I just wanted to put that as, a little caveat. So if you're getting a test question or you're seeing a client in the emergency department and they say their face really hurts, this is going to be the cranial nerve that you want to assess. Now, our last of the eye ones. Remember we skipped 5 for eyes. We're back to it with cranial nerve 6, which is abducens. And if you remember that 6 is abducens, you can remember what direction the eye moves. Because remember, abduction, which is one of the movements of the body, is when you move something away from the body. So I like to think of that as like abduct. So if something gets abducted, it gets taken away from you. So with that, you're going to like, this is me abducting my arm. I'm moving my arm away from my body. I abducted it. Abducting the eye would be moving the eye laterally. So you're moving it away from the body. So if I look at the camera here, hopefully you guys can see this. If I move my eye towards the sides or move it laterally, that is going to be cranial nerve 6. And this one's pretty easy to remember because lateral rectus. So the lateral muscle is in charge of course, lateral movement. So as you move your eyes laterally, think lateral rectus is the muscle, and that's going to be cranial nerve 6 abducens because we are abducting the eye away. Once again, you just assess that with cardinal gazes. So take your pen light once again, move it to the sides and have the client follow it with their eyeballs, and once again to the other side. Remember, we always assess both eyes. Even if you're only worried about one eyeball, you always assess both sides so that you have a good comparison. For example, a client may only be able to move their eye laterally on the right eye, but not the left. But if you didn't assess the left, you wouldn't know that. So make sure you're always doing both eyeballs. Now we're out of the eyes, guys. That's the hardest part of cranial nerves, I think, is the eyes. So we've mastered 2, 3, 4, and 6. You're set. Now we're on to cranial nerve 7, the facial. This is by far my favorite facial nerve to assess. And I stand by that because it makes everyone feel a little bit silly. It's a little bit dumb. And so it's fun to test. Remember, cranial nerve 7, facial, is of course going to have a lot of facial functions. But if you think about this and you say, you know, some say marry money, but my brother, so we're back to 7, brother is both. So it's going to have a motor function and a sensory function once again. The motor function of cranial nerve 7 is our facial expressions. I am a really animated speaker. I'm going to wrinkle very early. I know it because if I don't like something, oh my goodness, it has been something I've had to learn as a nurse is how to keep a straight face because, I walk into a room and it smells bad. You best believe my eyeballs, my eyebrows raised towards the ceiling. And so I've been working on my poker face recently, but that is my cranial nerve 7. I've got a really active one. It's your ability to smile, your ability to frown. I'm not a good frowner. Your ability to lift your eyebrows up, puff out your cheeks, clench your mouth. That's all going to be cranial nerve 7. So with that, you want to make sure that you are looking at those motor functions and that you're also looking at the sensory function. So we said motor facial expressions. What does it do sensory wise? It's taste. So the taste on the anterior 2/3 of the tongue is done by facial nerve. This is an easy one to forget because I will be honest, it is going to be very rare for you guys outside of nursing school to assess a client's taste. It's just not frequently done. That's just me being entirely honest with you guys. It's still important that you understand that it's in charge of it in case someone says that, they have lost their sense of taste. You want to be able to assess where it is. And then sense of taste is complicated by the fact that 2 cranial nerves are in charge of it. 2/3 of the tongue are one cranial nerve 7, and then the last posterior 1/3 of the tongue is another cranial nerve 9. And so that can get kind of confusing. The way I remember which one comes first is that facial, your face, is the anterior or forward 2/3 of your tongue. So the one that's closer to your face is the facial nerve. So if I stick out my tongue, those first 2/3, really the part that I can stick out, the last third of my tongue really is not getting out of my mouth at all. That's all going to be facial. So once again, we're going to assess this in 2 ways because it has 2 functions. So first thing you're going to do is have the client puff out their cheeks, lift their eyebrows up, scrunch their eyes. That's all going to be a great way to assess the facial nerve. It's really fun because I think it makes them feel a little funny. So I always demonstrate it as well so they don't feel like the only dumb one in the room. Give me a big smile, a frown, stick out your tongue, lift your eyebrows, open your eyes real big. Then with testing the sensory aspect, this is where that salt packet or that sugar packet comes in. You're going to have them close their eyes, stick out their tongue, and then just drop a little bit of one of those packets on their tongue and let them know if it is salty or if it is sweet. If they're able to identify the difference between those 2 flavors, salty or sweet, that function is totally intact and you don't need to worry much else about that. So that is facial nerve. As a little side note for you guys, asymmetry is going to indicate that if you see facial drooping or they're unable to close one eye or they can't get their smiles asymmetrical, you should immediately be thinking your client is either having a stroke or they have something called Bell's palsy or facial nerve paralysis is another term for that. So those are very different because Bell's palsy, not an emergency, you're not super worried about it. Whereas a stroke, you would be needing immediate intervention. It's something you'd be very worried about. So you want to make sure that any client that has asymmetry, you first off assume that it could be a stroke and you get testing done for that. Now we're on to cranial nerve 8, guys. Way to stick with us. We're 8 out of 12. We're making good movement. This is vestibulocochlear. This should let you know that it's going to be ear related because it has the word cochlear in it. If you think about, clients that have a cochlear implant to help them hear if they are deaf or hard of hearing, that's going to let you know vestibulocochlear, we're talking about the ear. So the function there is going to be sensory. It's our ability to hear. My dad always jokes that it must be motor too, because what if you can wiggle your ears? It's not. Vestibular cochlear is only a sensory function. It's our ability to hear. So the way we assess this is first off, I start with the easiest test. Obviously, there's a lot of different ways to assess the ears. And in nursing school, I go really in depth to the Renee test, into the Weber test, into the whisper test. But for now, for assessing the cranial nerves, you really just need to understand the whisper test. The way you do this is you're going to have your client sit down, or they can stand if they're already standing. You're going to stand behind them, and what they're going to do is they're going to close one ear. So you push on the tragus right there. And then what you're going to do is whisper in their other ear, just a few feet away from them. I like to pick 3 random letters and numbers. I usually do a mix, like 9HP. So I will whisper that. It doesn't need to be so quiet that no one can hear you. I have a few friends that when they whisper, I can't hear a blasted thing, and I have functioning ears. They're just very quiet whisperers. You want to whisper it enough that a normal person would be able to hear from the distance that you are. So remember, they've got one ear closed. In the ear that is not closed, you're going to whisper those letters and numbers, and then you're just going to have them repeat back what you said, and then switch, of course, to the other ear. If a client fails a whisper test, fails is the term we use, meaning that they just weren't able to repeat back those 3 letters or numbers, that would be when you do further testing, like the Weber test, the Renee test, or even, sending them to an audiologist who specializes in ears and can do more testing like electronically. If in school you guys ever had to put the headphones on, it does a little beep. You have to say, oh, I heard the beep. Oh, I heard the beep. That would be an audiologist. They'd be a great option for someone who you really thought was having cranial nerve 8 dysfunction. As a note for this one, anytime a client reports decreased hearing in an ear or vertigo, that feeling of, oh my goodness, the room is spinning around me, I'm super dizzy, that is going to indicate cranial nerve 8 dysfunction. So remember that, deafness and vertigo, think cranial nerve 8, vestibular cochlear. Now we've got cranial nerve 9, that's glossopharyngeal. This is going to help me remember if you break down that word, glossopharyngeal. So pharyngeal, we're talking the pharynx, that area in the back of the throat. So this one, of course, has 2 functions once again. If you some say Mary money, but my brother says big. So that's both. That is going to be both motor and sensory. So motor-wise, it's in charge of our ability to swallow and gag. Gag reflex is actually cranial nerve 9 and cranial nerve 10, so remember that. But ability to swallow, that's really important role of cranial nerve 9. That is going to be a big safety cranial nerve is what I call them. You could lose cranial nerve 3. Cranial nerve 3 is not a good example. You could lose cranial nerve 1, olfactory. You can't smell. Plenty of people live a full, exciting life without the ability to smell. Cranial nerve 9, our ability to swallow and gag, is a safety issue. If this cranial nerve is not working, you should be worried about their ability to swallow and that they're going to aspirate or choke. So we always want to make sure for stroke victims that cranial nerve 9 is something that we are assessing. As far as sensation goes, it's that posterior third of the tongue. And that's easy for me to remember because pharyngeal, remember, the back of the throat, that's going to be the back part of the tongue for taste. So that's how I remember those 2. The way we assess this is my least favorite cranial nerve to assess because no one likes to be gagged. I do not like it. I've never had a client enjoy it. And so you're just going to grab a tongue blade, have them open their mouth and say, ah. You want to make sure that the uvula is symmetrical, it's midline, right in the middle throat. It's not deviated towards one side, and that it raises when they say ah. And then you're just going to gently touch the back of the uvula with that tongue depressor and see if they gag. Then, of course, with sensory, it's just like you did for cranial nerve 7. Have them stick their tongue back, and then usually I'll have them put it on their finger so that they can stick their own finger in their mouth and just put a little bit of that salty or sweet on the very back of the tongue and see if they can taste and differentiate that. So cranial nerve 10, vagus. This is a big cranial nerve. It's got a couple different purposes. This, of course, once again, is going to be big brain. So some say Mary money, but my brother says big brains. So we've got both a motor and a sensory function for this one. Motor-wise, it's in charge of our speech. So it lets us, talk, it moves our vocal cords. But sensation, it's also innervated into the pharynx. So that's going to be our innervation there. It connects to our heart rate. So with this, you're going to assess cranial nerve 10 a couple different ways. Check their heart rate. If they're in that normal 60 to 100 beats per minute at rest, good indication that vagus nerve is innervated correctly. You're also going to want to assess their speech. So how often, when they talk, are you able to hear them? Does their voice sound overly hoarse? Can they speak their words? Are they struggling to get words out? That would be called aphasia. Those are all going to be things you want to look for. And then lastly, just like we assessed with cranial nerve 9, you're going to look at the pharynx by having them open up their throat, have them say ah. You should see that soft palate raise when they say ah. And then you're going to gently, and gently is the key word here, touch that uvula and check for a gag reflex. So once again, that was cranial nerve 10, vagus, with both a sensory and a motor function. Then we have cranial nerve 11, spinal accessory. So spinal accessory, I remember this one because we test cranial nerve 11, spinal accessory, by assessing what we call shoulder shrug. So if I put my hands up on a client's shoulders, I look a little weird here on a video cam, I'm sure. When you put your arms up on their shoulders, your arms look like two ones to me. So that is how I always remembered cranial nerve 11 is the shoulder shrug. That is going to give us the motor function of our head and shoulder. So it's only motor, no sensation. And it lets us move our neck and shoulder. So you test this a couple different ways. Like I said, shoulder shrug. You're going to take your client, stick your arms on their shoulders like this, like I'm demonstrating here myself. You're going to provide resistance. So you're going to push down with your hands while you tell them to shrug their shoulders up. That's all you do for that one. Easy, right? Then you're going to take your hand, gently place it on their face. I always warm them first because if you just go and put your hand on someone's face without letting them know, it may look like you're slapping them. It can be a little scary. It can be a bit of a jump scare. All of a sudden hand comes out onto your face. So I always say, I'm going to gently put my hand on your face. So then you do that, put your hand here, and then you're going to push against their face while you have them turn towards your hand. So do that, and then you're just going to repeat it once again on the other side of the face to test the other aspect of those neck muscles. Does that make sense, guys? Cranial nerve 11, I love testing because it's really easy. So shoulder shrug, and then turning the neck against resistance. That's all you have to do for that one, and that is spinal accessory. We've made it to our last of our cranial nerves, guys, cranial nerve 12, hypoglossal. So this one is another fun one to test, like cranial nerve 7 for me, because it's the last of the motor functions. It's the last of the cranial nerves. It is in charge of the motor ability of the tongue. So being able to wiggle our tongue, I don't know if any of you guys, this would actually be an interesting poll in one of my webinars one time to see how many of you guys can touch your nose with your tongue. Oh, look, I just did it. I didn't even know I could do that. I just learned something new. If you can touch your nose with your tongue, that is going to be cranial nerve 12 is innervated. But it's not just touching your nose with your tongue. Honestly, it's any tongue movement. So if you stick your tongue out, wiggle it side to side, that's all going to be cranial nerve 12. And that's the only way you test it. So it's really simple. You have your client stick out their tongue. I always say, wiggle it side to side, move it up, move it down. That means cranial nerve 12 is intact. So that is all of the 12 cranial nerves. I have a couple practice questions for us to go through now, because like I said, you're going to be tested on cranial nerves in your anatomy course. You're going to be tested on cranial nerves in your nursing courses, and you're going to be tested on cranial nerves on the NCLEX. So we want to make sure that you guys understand this material. Here are my 3 tips and tricks for you guys before we actually get into the questions. I want you guys to first off know how you assess each nerve. So that is what we just went through here. And if you want more help with it, these same slides, of course, are in our fundamentals and health assessment course for nursing school. So sign up for those for free, and you can get more access if you want. If you weren't able to get all the notes, if you were taking notes while I was speaking, all of these PowerPoints are available in that course. If you know how to assess that nerve, it's going to indicate the function. So if you remember, okay, cranial nerve 1, I'm having them smell something, that's going to be a really big indication for you of what it does. Oh, well then cranial nerve 1 is in charge of smelling. On the flip side, it may be easier to know each nerve function. So if you remember that, okay, cranial nerve 1 is in charge of smell, that's going to let you know how to assess it. If it's in charge of smell, if you're assessing it, you want to check their sense of smell. Oh, okay, you're going to have the client smell something and see if they can sniff it. So I usually pick one or the other, pick whatever works best for your brain. Either really know how you assess the nerve, and that's going to indicate its function, or know how the nerve functions, and that's going to let you know how to assess it. Lastly, know the major signs and symptoms of major dysfunctions. I mean, you don't have to memorize all of them, obviously, because there's a ton of different ways that, these that they don't work. But like facial drooping, for example, you should always be thinking that is going to be cranial nerve 7. You know, like we said, insomnia, the inability to smell, that's always going to be cranial nerve 1. So know the really big ones that are important, and that's going to help you answer questions. So here's our very first question. I'll give you guys a couple minutes. I'll read it out loud, and then I'll let you guys just look at it for a second before we move on to the answer and rationale. So with that, a 65-year-old client comes to the clinic and they're complaining of double vision, or the medical term for that is diplopia. So di meaning two, plopia, your vision, and also difficulty reading. When you examine them, you notice the client has ptosis, or drooping, of the left eyelid, and their pupils are unequal. The client is also having difficulty with their upward eye movement. Based on these findings, which cranial nerve is most likely affected? Go ahead and drop in the chat here what you think the right answer is. Is it going to be cranial nerve 4, trochlear, cranial nerve 3, oculomotor, cranial nerve 6, abducens, or cranial nerve 2, optic? So go ahead, everyone, put your answers in. I'll give you guys just a second to put what you think the right answer is. I'm seeing a lot of the right answer here, guys. This is good. This means that I was really able to teach this information well. It's kind of reflecting well on me and your guys' knowledge. So way to go. Okay, just to give you guys a few more seconds to answer this, I'm going to give you guys a hint now for anyone who's still maybe struggling with this. The way I like to think of this is, first off, eliminate anything you know is not right. So this talks about eye movement. They're unequal pupils and they're having difficulty with upward eye movement. So we know that cranial nerve 2, if you remember, is only sensory. Remember, some say there's no movement in cranial nerve 2, so we can get rid of cranial nerve 2 off the bat. We already know that. Then we've got, so we know it's a motor one. So now we've kind of narrowed it down to 3 options. And at this point, you'd have to remember which one was which. But if you remember, abducens means to abduct the eye. So to move the eye laterally. But remember, this client is having issues with upward eye movement. So we can get rid of that one too. And now I've kind of got it down to trochlear or oculomotor. And of course, like you guys all said, the cranial nerve 3 is in charge of oculomotor movement. That's going to be eye movements, pupil constriction, and even eyelid elevation. So if you were seeing that little try scenario in a client, you would worry that they had dysfunction of cranial nerve 3. Great job, guys. That was a hard one. Now we have our second question. A 55-year-old client presents to the emergency department after a stroke. Well, that sounds awful. During your assessment, they can't raise their eyebrows, they can't smile, and they can't close their left eye. They also report loss of taste on the anterior 2/3 of the tongue. Which cranial nerve is most likely affected? That's the first part of the question. But then also, what is your next priority assessment as a nurse? So look at these answers here. Go ahead, drop in the chat what you think the right answer is. Is it cranial nerve 5, trigeminal? Is it cranial nerve 7, facial? So those are the 2 options for facial nerves. So my recommendation would be, first, narrow it down to what you think the cranial nerve is. Is it cranial nerve 5 or is it cranial nerve 7? And then with that, you want to go look at the next part of the question. What's your next priority assessment? So cranial nerve 5, would you be assessing for facial numbness or tongue deviation? What's more important? And then for cranial nerve 7, your options are eye protection and taste, or the ability to smile. So you want to look at both of those and see what you think is going to be the most important assessment for you guys to do. Give you guys a few more seconds to drop your answers in the chat there. I'm seeing a lot of the right answer, guys. I'm really proud of you. This cranial nerves can get really confusing, so you guys are doing good. Okay, so remember, let's first look at what cranial nerve we think it is. They can't lift their eyebrows, they can't smile, they can't close their left eye, and they've reported loss of taste. If you guys remember, that is going to be facial. Cranial nerve 7, facial, is going to be that ability to smile, frown, close your eyes, and it also is taste. So because we know that, we can already get rid of option A, and we get rid of option C because we know it's not the trigeminal nerve, it's facial. Now you want to say what's more important, assessing for eye protection and taste or assessing for their ability to smile? Well, like all you guys put, it's going to be B. eye protection and taste. And this was a little bit of a hard question. It's something I want to drive home though. Clients that have Bell's palsy or have had a stroke and they can't close their eye, they're at high risk for blindness or corneal ulcers. When we blink or we close our eyes, it really lubricates our eyes. So it keeps our eyes wet and prevents dryness. One of the most important things you worry about in a client who can't close their eyes is that eye drying out and becoming damaged. So ability to smile, they may look a little funny. Their smile may, be asymmetrical because of the damage to that nerve. That's okay, but we worry more about the eye and them losing sight in that eye. So a lot of times we'll use eye drops or we'll tape that eye shut if they can't close it themselves. And so assessing for eye protection is going to be the most important assessment to follow up with. Okay, now this is our last question, and this is a two-part question. So this is the first part. Let's look at this. A 48-year-old client presents with difficulty swallowing and hoarseness. Upon assessment, you observe that their uvula deviates, so it moves to the side, to the right when they say, ah. They also have an absent gag reflex on the left side. Which cranial nerves are involved? So we have options here. We have cranial nerves 7 and 9, cranial nerves 9 and 10, cranial nerves 5 and 7, and cranial nerves 8 and 9. So go ahead, drop your answers in the chat here. What do you think the right answer is? Is it going to be facial and glossopharyngeal, glossopharyngeal and vagus, trigeminal and facial, or vestibular, cochlear, and glossopharyngeal? Oh man, you guys are so smart. Look, you guys are all getting the answer right. I am so proud of you guys. This is huge. Okay, as a couple tips for anyone who's maybe confused or struggling. Remember, I said it's easy to break down the term. So we know in our assessment, we're looking at things in the back of the throat, their uvula and their gag reflex. So we can get rid of facial because it's not going to be their facial aspect. We can get rid of vestibular cochlear because remember, cochlear, like the ear. So we know it's not D, we know it's not A, and we know it's not C. So what does that leave? That leaves option B for us, glossopharyngeal and vagus. Remember, those two cranial nerves together are in charge of our gag reflex. You guys all got that right. Awesome job. If you're struggling anymore, go ahead, drop questions in the chat. We can try to help you if that was a little bit confusing for you. Now, the last part of this question, because you're worried about cranial nerve 9, glossopharyngeal, and cranial nerve 10, vagus, dysfunction, what is your priority nursing assessment going to be? And I've left this question a little hard for you guys to challenge you because I've used the medical terms for some of these things. So if you don't know what these words mean, it's going to be a little bit harder for you of a question. Are we worried about dysphagia, insomnia, insomnia sounds like an inability to sleep, insomnia, dyspepsia, or aphasia? I'll let you guys drop your answers in there real quick. I'm seeing a lot of the right answer. I mean, I thought this one would trip you guys up. I thought this was a pretty hard question. You guys are doing great here. Okay, just like you all said, dysphagia is what we're going to be the most worried about. Dysphagia means difficulty swallowing. So if someone's uvula is deviated and they don't have a gag reflex, we're worried about damage to cranial nerves 9 and cranial nerves 10. And so what we're worried about most here, like we talked about earlier, is their ability to swallow. Because if they can't swallow, they can aspirate on their own spit, they can aspirate on food, and that poses a serious safety risk. So that's going to be the most important thing we assess for is dysphagia. Remember, insomnia is an inability to smell. So you'd be thinking cranial nerve 1 dysfunction. Dyspepsia is a term that means indigestion, your stomach hurts. It's a fancy term for a bellyache. So if someone says, oh, I'm having dyspepsia, what they're saying is their tummy hurts. They're probably having some gas pains or acid reflux. So that doesn't really have anything to do with cranial nerves. And then lastly, aphasia is our ability to speak. Aphasia can be caused by cranial nerve 10. So this is why this was a little bit of a trick question, I said, because cranial nerve dysfunction, remember, cranial nerve 10 innervates our vocal cords. It's our ability to speak. If someone can't speak, it's likely going to be cranial nerve 10 dysfunction But now remember, the question says, what is the priority nursing assessment? Remember, when you guys answer questions like this, you want to look for those key words like priority or first. Dysphagia is a higher safety risk than the inability to speak. Plenty of people are considered mute. They don't speak for a lot of different reasons, whether it be intellectual disabilities or cranial nerve dysfunction, and they live full lives. Dysphagia and the inability to swallow or difficulty swallowing is a safety issue, and we always address safety issues first. Okay, guys, those were the questions we went through today. That gets us to the end of this webinar. Just one last thing. If you felt like you were struggling or you're struggling in nursing school or studying for the NCLEX and you just want a little bit more help one-on-one where I can answer all of your questions in real time, you can interrupt me mid-sentence and say, oh, wait, Annie, I don't understand what you're saying. Go ahead and sign up for private tutoring. This is going to be one of the best ways I think that we can really help students that are struggling or don't understand a concept, because it's going to be very individualized to your needs, so you can pick what you're struggling with. So if you have an issue with this one thing, you can sign up for this one course and you can just talk to me for a whole hour about cranial nerves if you want more help with that. Or you can spend a whole hour with me talking about dosage calculation. Brandon, for example, is amazing at math, does great dose calc, tutoring. So here's the QR code here to sign up for private tutoring. If you have questions for the tutors or about what we tutor in, or if you need special, help with tutoring, you can go ahead and email that. But that is the end of our webinar, guys. I'm really proud of seeing you guys answer those questions. I threw in some tricky ones there because I really wanted to watch your guys' brains work through what's the cranial nerve, what's the function, and how do we assess it. So I'm proud of you guys. You did great. That brings us to the end of our webinar today. So I'll go ahead and close this out. If you have any last questions, go ahead, feel free to email us. Once again, you can sign up for that nursing school free through the end of the year. Thanks for joining today, guys. Oh, my name, Maria, I'm Annalise, or you'll often hear me go by Annie. So nice to meet you guys. Happy to have you here. Happy to teach this. Cranial nerves were something I struggled with in nursing school. And so I just want to make them very easy and broken down for you guys. Keep it simple. Have a good day, guys.